I'm going to Salisbury University in Maryland, so 3 hours away from home. I think moving to college is a big part of transitioning because I have to do everything on my own now.
When we went down for pre-registration, we decided we would spend the afternoon looking around and finding out about some of the medical facilities. We figured we might as well, we're down here anyway, we might as well look around. And so we went and talked to the appropriate people, find out about the pharmacy, about the local facilities.
They have a good medical center there, so I'd be taken care of if I ever got sick.
We just wanted to be prepared so that, because we know she's going to have to take care of these things when she's down there.
I have to take care of my medicines and my ostomy and ordering everything.
Yeah, we definitely had some contact with the school nurse. And I think we let her know, especially the first time I went to college, that I had Crohn's and I take medicine.
They need to get their records into the healthcare at the college itself, not necessarily a physician, but the health office that's there.
If I had to be rushed to an emergency and if somebody knows that I have a file, the nurse has it, this is what he has, this is how many medicine he's taking, this is what, something might be wrong, so we did let him know.
You can be 6 hours by a plane away and still have good health care. So that you should pick your college based on your areas of interest and what is the best fit for you.
When I initially went to college, I had SUPAC and Dr. Piccoli write up a letter, and they kind of said these are my needs, especially in the dorm situation.
And we work with the schools and with the families to do absolutely anything we can to get special accommodations and special understandings so that our patients who face a chronic illness can actually succeed in college and move forward successfully. That's really very important to us.
From my first class, I asked Dr. Mamula for a letter saying about my condition.
We provide letters both for their accommodations as well as for the teachers at school to understand that they may have symptoms, that they may miss classes, they may miss some schoolwork because of their condition, because of their disease.
If I have to leave or if I have an emergency that has to do with my condition, that I have proof from the letter that there's a reason for me to be dismissed.
I was pretty healthy going into college, but then my second year when I started, my sophomore year, the first semester, I started getting pretty sick, and I actually had to take some time off.
Kind of disappointing to both her and her parents, to say the least, and we had to work through that with the school.
My college was wonderful with me and willing to work with me because it was right before finals and I didn't get to take finals because I was so sick. So they were willing to work with me and saying, whenever you feel better after you have your surgery, we will give you your finals if you still want to take them, and we'll move on from there.
They were quite accommodating in regards to crediting her for about 80% of her tuition.
And they definitely worked with me and gave me what I needed and weren't discriminatory. They can't be with the 504.
So 504 plan, in my mind, from a school standpoint, is extremely important because it allows the children to continue to go to school and continue to get the services that they should without the school saying, oh, well, the kid hasn't been to school for 10 days and therefore has to start all over again.
I used a 504 plan for high school and it was really helpful. So I didn't actually know they had it for college, but I'm going to look into it now.